Now, currently, the country is experiencing a measles and mumps outbreak. Both are preventable by vaccines, although the MMR vaccines for mumps is not currently part of government's immunization schedule and is only available in the private sector. At the same time, the country has also detected cases of diphtheria and has seen an uptick in reported malaria cases. Let's now bring in Professor Adrian Puren, who is the Executive Director at the National Institute of Communicable Diseases. Prof, thank you for making time for us. Let's start first with an update on the outbreaks you have communicated recently. Where are things standing now?
Certainly. So thank you very much for the opportunity to present the broad picture about why we do all of this. So when you look at the different outbreaks that are currently ongoing, so measles is a good example of a vaccine-preventable disease. As you said, it's part of the government's expanded program for immunization. It's been an ongoing program. And we've seen a large number of cases in the various provinces with the exception of the Eastern Cape. The current trajectory of this particular outbreak is that there is a decline in the numbers of cases. This is probably a result of those that were susceptible, for example, but more likely an important contributor is the fact that there were what we call catch-up vaccine campaigns in the different provinces. Limpopo is the only province currently that still has a larger number of cases, but we think that with the expanded program of vaccination in that particular province, that the numbers should decline. Mumps, as you mentioned, is also a vaccine-preventable disease, but as you commented, that in fact, in the public sector at least, the availability of this vaccine is not currently present. So, but we do have what we call endemic circulation of mumps. It's an ongoing circulation, but what was key here during this last few months is in fact that there was anecdotal evidence that there was an increase in the number of cases. In fact, when we did what we call a laboratory investigation in terms of the numbers, we could certainly clearly show that compared to previous years, that in fact that the numbers were certainly had increased. But again, we just need to be cautious about mumps because again, it's, as I said, it's not a disease that is under current surveillance as such. The diagnosis may be underdiagnosed, so the numbers may really be larger than we think it is. But again, it's because it's not what we call a notifiable medical conditions. And this is one of the things I do want to emphasize is that in the country we have what is called a notifiable medical conditions system. So things like measles, polio, in fact, we haven't even spoken about the two other diseases, for example, cholera and salmonella typhi, that are also in circulation currently. These are notifiable medical conditions. So by law, any case that's been identified, for example, clinically or in a combination with laboratory diagnosis needs to be reported within specified periods. So that's the importance of this particular system, and therefore why we also inform sometimes the WHO, for example, if that were really critical, and or the National Department of Health responds to these types of notifications.
So there's some children, Prof, who have had the extra measles booster in the last 6 months. Can they get the MMR, or do they have to wait a certain period of time due to the additional measles portion of the MMR?
Yeah, so again, if you've been vaccinated, and you don't know whether you've been vaccinated, and you're part of this broader catch-up campaign or increased coverage campaign, then you can certainly accept that, even though you may have had that vaccine 6 months ago. So, as you know, in the public sector, so far we only are providing the measles part of the MMR. It's planned, I think, for next year that in fact we will include rubella, so there'll be the MR in terms of that particular approach to controlling. Because again, rubella is reportable in certain, but we don't have the rubella vaccine currently present in South Africa. But this will change, obviously, and that will lead, where we hope, at least, to a decline in the numbers of cases.
Yeah.
But what is very critical, for these particular vaccines, such as the measles and rubella, is in fact, we remember when we spoke about community immunity or herd immunity. So it's very important that we reach substantial levels, especially measles, substantial levels of vaccine coverage. It needs to go up to about 95%, and very often we've not reached those particular targets. COVID-19 has certainly had effects, not only in terms of accessing healthcare, but in fact also these particular vaccines and access to vaccines. So we do think that there's a contributory factor in terms of COVID-19, in terms of actually reaching those particular targets. I think there was a problem beforehand, but it certainly was exacerbated by the fact that we had COVID-19 present as well.
Yeah. Are these outbreaks abnormal, or is this just a show of how the Department of Health and even as the NICD are becoming good at communicating these and tracing them?
Well, as I said, there's a mandatory duty, in other words, and it's very critical that we inform the public, to protect the public and to tell them what to do and to inform them what is in circulation. So this is not abnormal. This is what happens. We have all these infections in circulation. We've had COVID-19 in circulation and it continues to circulate. And on top of that, certainly, I think that some of these events may seem abnormal, but they're not. They're part of what is in circulation in terms of infections. So the rubella, the measles, and so forth. Some of it, I suspect, can be attributed to the fact that we also had, those non-pharmaceutical interventions. So if you're looking at the influenza season, so we're going to go into a flu season very shortly. But if you recall, about a year or two ago, we didn't have the normal flu season because we wore masks, there was social distancing, ventilation, all of those particular factors certainly affected that. I think the removal of that has certainly, if you like, allowed for further and continued expansion of these particular viruses. So I don't think it's abnormal. This is what we see from time to time. I think it's just unusual that we've seen Mpox, for example, although we've been quite fortunate in South Africa that the numbers of cases were substantially low. But then we've had measles, and I think the consequences of the result of us seeing that is because the fact that the level of vaccination has not been achieved. And then we've had other outbreaks outside of South Africa, for example. So again, the cholera is a really good example of in other countries and importation, and now we have some degree of endogenous circulation of those particular bacteria as examples. So I wouldn't say we're in an abnormal situation. I think it's just that we need to be aware and what we need to do as the public in terms of protecting ourselves.
Okay. Yes. Do we know, Prof, whether there has been a decrease in access to childhood illness vaccines, which may have led to the outbreaks like mumps and measles? Yeah,
so I would think that, some of these things are seasonal as well. So I agree with you that certainly when we look at measles, for example, the possibility, again, does exist. There's some recent publications that have come out just to look at the health system of itself and the public access to the health services, and the way in which I suppose there was an emphasis on SARS-CoV-2, which certainly I think has probably led to a decline in access and or the provision of vaccines that has led to the current situation. So it's really critical, again, that we inform the public. If your child is not being vaccinated, not fully vaccinated for measles, because it's a good example of what you can access and is available, then please have your child vaccinated. I think it's really critical that message is really important. And as you know, the various provinces have gone on these particular campaigns to try and catch up and cover and ensure that children are vaccinated. But again, if parents are unsure whether or not they've been part of this campaign and are clear that their child has been vaccinated, then again, it's really important that they access facilities. But you're right, COVID-19 had quite a tremendous effect in terms of infectious diseases in the country and its management.
Yeah. But are the parents taking up these vaccines, even for their children? Is there even any evidence of vaccine hesitancy? I'm just trying to figure out if we know what the current childhood inoculation rates are.
Yeah, so I think we will see this coming through. I think now that the campaigns have been wound up, we will see what the extent of coverage is. And I think the evidence, at least in some of the provinces, leads me to think that In fact, it has been successful that in fact it's targeted the right groups. So we certainly are seeing a decline in the numbers. I don't think that vaccine hesitancy has played a major role, at least in some of the provinces that we've seen. But you do raise an important point that, compared to maybe a decade or more ago, there is this extent of vaccine hesitancy has certainly grown. And I think it's a spectrum. I think it's a spectrum of people who have particular religious or philosophical approaches that counter against vaccination. But there are also people who are hesitant in terms of, I don't want my child to be vaccinated because it may be painful, for example, or have some sort of fears around that. And so I think there's that range that in terms of how we should approach so-called vaccine hesitance. I don't think it's just that specific group that is anti-vaccine. I think it's a range and a spectrum, and so I think we need to engage along that particular spectrum to ensure that parents do vaccinate and protect their children. I think that's really critical.
Okay. Professor Adrian Puren, thank you for joining us for this chat, the Executive Director at the National Institute of Communicable Diseases.